Welcome to today's Society for Psychological Anthropology event entitled How to Save the Child, Forms of Maltreatment, Sites of Inquiry, and the Complexities of Advocacy. So I'm Kathy Trang, and with me today is Amir Hampil. And so together, Amir and I are co-editors for the Society for Psychological Anthropology's column on anthropology news and related media. So today's event is the first of a new SPA series entitled Global Voices. And this is a new series that will explore the work of psychological anthropologists working outside the United States. The idea for this series originates in the recognition that the SPA is an ever-expanding global community. Fundamentally, what the series aims to explore are the diverse conversation and insights.
Well, that's the video.
The diverse insights that are unfolding worldwide, and also and the ways in which the society can better represent and serve the needs of its members, foster and strengthen this global community. So today's event is a brilliant one that will kick off this series. And now I turn to Amir, who will introduce today's speakers.
Thank you, Kathy. Today with us, we're honored to have Dr. David K. Kaawa-Mafigiri, an anthropologist from the Department of Social Work and Social Administration at Makerere University. He is, along with Eddie Walakira, editor of the 2017 publication Child Abuse and Neglect in Uganda. This is the first volume about child maltreatment in an African country written by scholars from that country. Dr. Kaawa-Mafigiri has conducted over 20 years of research on medical issues in Uganda, including HIV treatment, tuberculosis, and alcohol use. He is also deeply involved in developing local capacities for medical social science research in Uganda. This includes serving as Associate Director of the Center for Social Science Research on AIDS, funded by the NIH. In this capacity, he has coordinated research on AIDS and treatment-seeking behavior in Uganda and developed training programs for researchers. In conversation with Dr. Kaawa-Mafigiri, we have Betsey Brada with us today. She is assistant professor in the anthropology department at Reed College. She has conducted prize-winning research on HIV interventions and medical training in Botswana. Her work interrogates the encounters between local patients, caregivers, and international aid organizations. Dr. Brada is currently conducting research on the development of Botswana's first medical school and on how this school is being shaped by transnational ties. Thank you both for joining us today, as well as everyone who's listening in. David and Betsey will first have a talk for 45 minutes to an hour, and then we'll open this up for questions. You can submit questions in writing or just by speaking up. So thank you, everyone.
Shall I begin?
Please.
Yes.
Okay, good morning, David. It's lovely to meet you. Perhaps you could begin by telling us a bit of the background behind the volume on child abuse and neglect in Uganda that you co-edited. What were the circumstances that gave rise to this volume?
Thank you very much, first of all, for having me on this series. It's a privilege, it's an honor to be here. And I'll begin by saying try to speak slowly because, of course, I speak with an accent. And so anyone who needs clarification from our listeners, please don't hesitate to request, but especially that I repeat my response. Why don't I begin, since we are talking about child abuse and neglect, the book, by saying that I begin on unfortunately a sad note, but I need to get it out of the way. I want to dedicate today's conversation to colleagues, friends in Uganda, specifically I'm talking about Dr. Noel and his wife, Dr. Noeline, who on Friday lost their 12-year-old child to malaria. So this is really a sad time, but this conversation will be dedicated to Jemima was her name, Angela. It's a very sad time. So I'm sorry I can't be there for them at this time physically. So we are here to talk about child abuse and neglect, the volume. What inspired this book in part is our work in Uganda with Eddie and other scholars who have contributed to this volume. But the genesis really lies in our collaborations with partners from the Global North, who have been helping us with building our capacity to conduct research, to generate evidence over the last 30 years specifically, but more broadly over the last 10 to 15 years. I will use this opportunity also to just point out and acknowledge these partners as we go along. We've had research collaboration with partners in US universities and in European universities. And one of the important partners has been the Case Western Reserve University in Cleveland, Ohio. The Department of Anthropology there has helped the scholarship in Uganda through training, through conducting research together. And one of the areas we've done research is, of course, in health, in infectious disease control, including among children and women. When you put this work together, you'll know that a lot of evidence generated in or about Africa comes mostly from the Global North, the West, and rightly so, because capacity, skills, resources mainly come from the North. So we've had some very good work done over the past few decades where people from the Global North come, study the context in Uganda, in Africa, and generate evidence that impacts our policy. But you'll know as anthropologists that sometimes there is a limitation. There is a scholarly limitation when, as an outsider, you study the perspectives of another community, another context. We have been equipped with skills to recognize this limitation. And we've taken this into account as we have continued to grow in our skills levels to say, we also need to generate evidence. We also need to generate evidence from the emic, insider perspective, from the context, from people who have got a perspective about the culture from which they've grown into. So this is partly what has influenced the development of this activity of this book, writing of this book. So we came together as a group of scholars, as a group of implementers, practitioners within Uganda. Most of us are Ugandans, and we thought at this point in time, we need to have a synthesis of the evidence on child abuse and neglect, on child maltreatment, on child well-being from the perspective of Ugandans. We still needed a lot of help. We needed, for instance, to get knowledge and skills on how to synthesize this material. And as we go along, we'll describe some of these activities. So we still went into sought to collaborate with our good friends from the Global North to support our efforts to try and synthesize and generate this evidence. So essentially we put together different bodies of literature, of studies, of results from different organizations and work being done, and put it together into this volume. In a period of about 2 years, we were working on this volume. Why don't I first stop here? If you have another question.
I do. Let me ask two questions. The first question is this: looking at the contributors to the volume, the contributors are coming from a wide range of backgrounds: social work, anthropology, sociology, environmental management. Can you say something about the interdisciplinary nature of the volume and the places where there's a great degree of overlap or consensus, either conceptually or methodologically, and places where there's some divergence in approach amongst this very heterogeneous group of contributors? That's the first question. And the second question is, could you say something, please, about the audience that you and your co-editor imagined for this volume? Specifically, to whom were you addressing the volume beyond other interested scholars? Were you hoping to influence specific policies? And if so, how and which ones?
Yes, thank you very much for those questions. Yes, the unique feature about this book and the entire process of coming up with this book, a hallmark is the interdisciplinary nature, as you rightly point out, of the contributors and the material therein. And so if you look at the way the book is structured, it will also reveal that there was a deliberate effort to seek out a wide range or a diverse range of disciplines. Of course, parent discipline here is anthropology. So the editors, we are anthropologists, we are social scientists, but the nature of our work in a resource limited setting is that you find yourself working in different sectors, working together with different other sectors more frequently than perhaps in settings where there are a wide range of people with skills in specific areas. What do I mean here? The skills level in our setting, such as in sub-Saharan Africa, is that you may be an anthropologist, for instance, but will almost certainly work together with or work alongside other areas, other people, other disciplines. So for instance, we tend to lean more towards the academic sector or environment, academic angle. But there are so many people in policy and in practice who then call upon your assistance, if you will. And sometimes these people are not working as anthropologists or are not anthropologists by background. And so because the number of, the pool, call it the pool of experts is not as wide, we have found that through our work in the last 15 to 20 years, we've interacted with so many people of different disciplines. So that is one. But secondly, we also recognize now that the problem we might be dealing with, in this case, child protection, child abuse or maltreatment, is linked more broadly to other sectors within our context. So to deal with this problem, the frameworks that we need now are supposed to be holistic. That is apparent to us now, that we may need to engage people with different skill sets, people with different backgrounds. And in order to do this, we work with them, we build their knowledge levels, we share with them. We also appreciate their concerns or their perspectives. And one way to do this is to closely work together in generating much needed evidence. So it is true the contributors come from a wide range of background, and we deliberately sought this. So we approached, as we were synthesizing our literature, we invited people from either academia or social work practice, from legal and other protection units, in order to build this volume. So it is a very interdisciplinary book, speaks to the interdisciplinary nature of the contributors. Of course, the process of generating it and writing involved a lot of contestation, if you will, points where we would contest certain aspects, because you've got to remember we were writing, if you will, scientific empirical work. And sometimes some of the topics we are discussing are quite sensitive and can be very difficult to generate evidence for. And so we would argue back and forth through the peer review process with people, contributors whose background may not necessarily appreciate why the rigor for which you're requiring them to produce this work. But they appreciated it over time, and we enjoyed the process, the learning process. It was a learning process for all of us, and I believe that at the end of the day, we reached more consensus than divergence on these issues, on any of the issues which are in the book. Let me speak about the audience. We think that our audience at the time, we were thinking in terms of the academia, policymakers, people who implement programming, and this will include both government and non-government actors in child protection, as well as students. We also aimed to reach both local, in this case, Africa, East Africa, and international audiences. And so that was the audience we were thinking about. Thank you.
Thank you very much, David. Let me see if I can build on your answer to ask you, a question about research capacity building, right?
Right.
Which seems like it was uh, part of the impetus for this volume. So on the one hand, there's the importance of Ugandan researchers conducting the research and bringing their perspectives to bear on this issue. There's a question of the paucity of data with regard to this particular issue. And then there's the question of research capacity in Uganda. Where exactly do you see research capacity with regard to medical social science needing to go most urgently in Uganda? And how does this volume contribute to that?
Yes. Thank you again. Research capacity in Uganda has improved greatly. It has improved greatly. However, it still remains, I think, very limited. The critical mass is still uh, below a level that can, significantly impact uh, development. The development here being defined to mean, improving in our ability to comprehend and impact, humanity, human development here. So there is tremendous improvement, but again, I think it is still severely limited. I know that, you can have indicators of research capacity, either publications, number of universities with PhD holders, and those kind of output indicators. But you still think about how much work is not known, how much knowledge about certain activities is not yet known. The paucity of literature, of evidence, as you have pointed out, then you realize that research capacity still needs a lot of improvement. You have mentioned something very important here, bringing medical and social science together in the same sentence here. Uh, Research capacity in the health field by non-health sciences, so social science, anthropology, in the health field is actually very, very limited. And yet we know that health is more than just, biomedicine. So without taking away the improvements in biomedical research capacity, which I might argue have really been fueled by the last 30 years of HIV/AIDS research, HIV and tuberculosis, but the capacity has been, grown in other areas as well, but mostly, in my view, fueled by the epidemic of HIV and tuberculosis. So without taking away from how much that biomedical research has improved, we still find that research capacity in the health or biomedical realm, from a social science perspective, for instance, is very, very limited. What this book to us contributes in this context is, one, to illustrate that we can build capacity in different ways. Building capacity is expensive. You could train people, you could have them go for training abroad, or you could bring international experts to train within the country. All these are very expensive ventures. But you can also build capacity through mentorship, for example. When you think about how we generated this book, there was a lot of mentorship from our international collaborators. So the quality of, or the qualitative aspects of capacity building here are highlighted by such a volume. And I want to also argue that it was not as costly. It wasn't cheap, but it was not as costly as taking, we could have asked for, dedicated time to write, for example, throughout the year. Take leave or get sabbaticals or something like that. And those can be very expensive. Yet they are needed capacity building efforts. Accessing resources such as libraries, such as internet, things we may take for granted when we work at the higher levels of academics, but just accessing good libraries online, the cost of internet and those kind of everyday activities help to build capacity, yet remain stumbling blocks from our setting. Time is very important. Getting dedicated time away from the teaching load, and the teaching load in for instance in Uganda, in Ugandan universities, excuse me, the teaching load is such that getting dedicated time to write can be a limitation, can become a problem. Is of concern because it's common to teach, throughout the day, and then sometimes even into the evenings or weekends. The classes can be massive and numerous. Again, because of the limited number of the pool, the limited pool of teachers. For instance, we have just only recently had more than 3 or maybe 5 universities in the country. It is until the last about 5 years that we have more than 5 universities. And not all these universities are well equipped, the human resources. So you're really talking about 3 to 4 universities where everyone will seek to attend. And that means the teaching load is so high, so large for the teachers. Now, writing, research and writing are also part of the terms of reference for anyone in academics. Unfortunately, so is teaching. And teaching can take a lot of time. So just to sum up on this question, I think that by coming up with a book that has a range of disciplines and illustrates the ability, the need, first of all, illustrates the importance, but also the ability to come together as people from different backgrounds to try and work together to come up with good scientific evidence. Trying to work alone would have been overwhelming for every individual discipline there. Thank you.
Thank you very much for that answer. I find what you have to say about the qualitative and practical aspects of mentorship really thought-provoking.
Right.
And I'm glad that we've had the chance to talk a little bit about the landscape of qualitative research, social science research with regard to health topics in Uganda, and the way it seems like it seems like it threatens to almost become a division of labor, whereby given the constraints on teaching, Ugandans could possibly become the ones who are teaching, and outsiders become the ones who are doing research. And it seems as though the volume that you've produced really pushes back on this idea that Ugandans cannot be experts of their own country, of their own people. So I think that's really thought provocative. But I wanted to give you a chance to say something more specific about the topic of the book. Why child maltreatment? And why child maltreatment in Uganda specifically?
Yes, thank you. You know, in Uganda, the largest number of people are children. You know, approximately 56% of the population are children. So, if you know that our population, if I may refer to a population pyramid, is the shape of a pyramid. So we have so many children, which means the country is essentially in the near future looking at these children to be the foundation for further development. But I also wanted to say that in generally sub-Saharan Africa, I know even in other parts of the world, but specifically in sub-Saharan Africa, the state of the child is far below what we would want it to be. In Uganda, you will know that there are certain, we are signatories to certain conventions, UN conventions, like many other countries. One of those is the Convention for the rights of the child, right? And you'll know that what we want under this convention, what we are dedicated to do under this convention, is to ensure that there is protection of the child from any form of physical or mental or psychological abuse or neglect, exploitation, sexual abuse, either in the care of parents, legal guardians, or any other person who has care of the child. So when you think about Uganda, we still grapple with the prevalence of abuse and neglect. It is still high. We know, generally in Africa, we know that about 230 million children report experiencing some form of violence in their lifetime. In Uganda, we know that over 40% of children in East Africa, but in Uganda specifically, experience some form of lifetime violence, whether it is physical, psychological, sexual. There are several studies now, in fact, following this book that have also come out to give a little more about the evidence on prevalence of abuse and neglect. So what I'm saying is that the biggest number of our population who are children are suffering a lot of abuse and neglect. It is a problem of public health significance, if you will. It is a problem that is undermining development. It's a problem that undermines our citizenry. The quality of the citizen will depend on, the socialization and and how much development, early development of the child, how much good quality goes into early development of the child. So we know that many children are in school, but even in school settings, lifetime experience of physical violence is still very, very high, including from school staff. We know nearly 90% of boys and girls as well report being exposed to violence in school. We know that a lot of those who have experienced violence in school get it nearly half, more than half actually, about 52% report experiencing this violence from school staff. So you can see that the problem is a little bit maybe more, grave compared to what normally is known or talked about. We also know that we've had a lot of some effort to try and control and protect the child. Different legislation, administrative approaches, yet abuse continues to remain a burden, continues to remain a problem in this setting. Now, in order to control, to reduce, to improve the well-being of children, in order to reduce this abuse and neglect, it is now apparent that we need to find different ways to approach what you would have called the conventional approaches. Clearly, the conventional approaches in the last few years or decades are not doing well, are not stemming the problem of child abuse. One of the limitations has been the lack of evidence, good evidence. That's been a severe limitation in some of the approaches. Some of the contexts where this abuse is taking place are very sensitive. Homes are very sensitive areas, spaces. The community is a very sensitive space where some of the abuse is taking place. So it is a very difficult space to go and investigate. More so from relying on outside help, you tend to find it a little bit limiting when studying some of these sensitive spaces. So we who have had the opportunity to get certain skills, the ability to collaborate with other skilled people, moved ahead to say we need to examine the state of the child. We need to put together evidence that can inform our policy and our implementing partners. And we felt that if we study this problem as Ugandans, as Africans, and present to them and start to generate evidence that can be used without easily feeling like it can't be taken on, then we shall move ahead. We shall make a big step ahead in trying to reduce the problem of child abuse and neglect. So if you look at how we went about this book, what inspired us, we decided to say we will first and foremost take into account research and theory as an approach. What can we do in the area of building research evidence, in building collaborative partnerships? How can we situate the way we understand the problem of child abuse and maltreatment from a theoretical research basis? And then use some of those frameworks, some of our understandings to examine the communities where the child is growing up, is being protected, and try to study some culturally specific forms of child abuse. Culturally specific here, meaning that the spaces that I've talked about, very sensitive spaces in the community, cultural, social dimensions of child abuse. Some are so sensitive that they may require, some sort of insider perspective in terms of trying to build evidence of child abuse without necessarily feeling as if you're pushing back at people's cultural practices. So we were inspired by, of course, the skills we had now acquired through our training on how to, have an introspection of, cultural spaces, studying about social, political economic spaces, and then look at practices, look at the dimensions of child abuse using these lenses that we now have used to cast on our setting. Let me first stop there.
Thank you very much for that answer. Let me follow it up with sort of a thorny one, and that is this. Yes. In my own research in Botswana, one of the things that emerged as I looked at American clinicians speaking with Botswana parents, grandparents, aunties, uncles, and the HIV positive children that they were accompanying to the clinic, was that they sometimes had very divergent understandings of what is appropriate behavior for a child and what are the appropriate ways to interact with a child. For example, the American clinicians were sometimes shocked and displeased to find children of the age of, say, 9 or 10 years cooking, because they felt that this was a form of labor inappropriate for a child of that age, and that these children should be playing, and they shouldn't be having to engage in these forms of domestic reproduction, if you will. And on the part of the parents, they were sometimes a little confused about why the American clinicians were so invested in sort of extracting from children all of their unique and personal tastes regarding their favorite subjects in school, their favorite things to eat, their favorite music to listen to. They talked about favorites a lot, and this was sort of something that for the American clinicians, that's just how you talk to a child, right? That's the kind of conversation you have with a 9-year-old. You're not, there's all sort of background ideas about whether you ask children lots of personal questions about themselves in a clinical interaction to begin with, right? And then you have the question of sort of what is the content of that? What forms of self-expression are you looking for from a child? What looks like responsibility on the part of the children? Right. So the reason I'm bringing this all up is because what I'm most interested from you is how did you and your collaborators arrive at a sense of what constituted violence for children without working from an established definition of it? Right? The American clinicians that I was observing were coming into their interactions with children with an already established understanding of what a child was and what they should do and what what they shouldn't do, and how adults should treat them. So with that, since that's sort of not generally how anthropologists approach things, how do you arrive at an understanding of what in Uganda constitutes violence without smuggling in norms from somewhere else?
Right. Thank you very much again. First of all, you're right that sometimes when we are working with very sensitive areas like child abuse, a very sensitive area, some aspects of child abuse. I will use the example of child labor also. Uh, very sensitive, highly contested, even within our own context. Um, I have told you, on the one hand, we are bound by international conventions. So there are certain definitions, if you will, from which we proceed, and we subscribe to, of course, as a form of standard that we may use. However, we also have experienced um, interest, effort from government and other actors sharing interest to or realization of a need to adapt these different definitions to the local contexts. We commend them for noting a need to tailor. So there are different actors, funders, who now will recognize a need to study and understand how can they tailor certain interventions, knowing and recognizing that, if it is institutionalized care, for example, we know that institutionalized care is an approach that is used elsewhere, but how can we tailor it in order to match and fit all these contested sites? So, if you think about child labor, its definition, as opposed to child work, has brought up this distinction between child work, useful, productive child work, and child labor. And we have a lot of debate going on now. To what extent, where do you draw the line? If somebody, a local non-government organization implementing child protection activities was in the community, how will they differentiate between child work and child labor? What are the skills sets they need in order to do this? And we are in the processes of developing different types of guidelines in collaboration with all the funders, experts that are helping us. So I'll tell you, for example, that there has been, for instance, a tendency to consider every type of work that children do as child labor, even when we know that the national and legal frameworks try to draw a distinction between child work. So child work is what we call acceptable, an acceptable form of work or training, and child labor, which in this case has got to have some element of, it's hazardous or affects physical, mental, and social well-being. But you could find that when we discuss this work, even with colleagues in different fields, professionals, and you say, well, maybe we need to investigate child labor and child work. And they think, well, I think children should learn how to do household chores, go and collect water. The girl child should leave school early or go late into school because she has to go 2 miles away every day, twice a day, to collect water on her head. Like I don't know, 4 or 5 gallon size can. And you say, no, she's training. She's 9. She's training. Or household production, which you are talking about. Are they going to dig? How long do they dig? Compared to household production where the mother needs to sell some, to hawk. She's a hawker, hawk goods in town and asks the child to assist carry around. If you've been to Botswana, maybe Botswana is Gaborone is a little bit of a nice, rich town, but you will know from rural Gaborone that there's a lot of work that children do on streets. I think selling products late in the night, but on behalf of parents who are sending them to say, go find out where and help produce, contribute to the house. So it is true that we are struggling with that line. That line is not very easy to differentiate. But we also know that, at a certain point, you can, a child who is working in a mine or in a farm for cheap labor for hours on end, missing school, and is not out playing with kids at all of their age, is being exploited. So I guess to answer your question, to some extent, it is not so difficult to identify that line. But it is true that it is very contested, and you find that in our setting, even the parents, many parents who still hide behind issues of socialization, developing the child and that kind of thing, inhibit, become a stumbling block in trying to, sensitize or advocate for the rights of the child. I'll stop there for now.
Well, thank you very much for that answer. Maybe I could follow it up by asking you to say a little bit more about how, for you or for the other scholars who contributed to this volume, how to think about violence as something that can differ based on gender or rural versus urban. You sort of mentioned, certainly I've seen children in Gaborone working, although the kinds of labor that one sees children engage in rural areas is different from what you see in more urban ones. But it seems then that the kind of violence that this volume is trying to get at is something that works itself out differently depending on the context, whether it's a question of a child contributing to a household,
right,
in a way that doesn't interfere with other forms of socialization, education, doesn't get in the way of their general well-being, or whether it's a form of labor that where the interests of the child really seem to be shoved to the side. But that seems perhaps is less sort of always a question of kind of what kind, sometimes it's a question of what form the labor takes, and sometimes it's a question of, well, how much time are we talking about, or what are the circumstances we're talking about, or which kind of child is expected to do this and neglect her studies in favor of another child.
right.
So could you say a little bit more about kind of the plurality of forms of violence that you're talking about?
Right, thank you. Yes, the forms of violence, as I mentioned earlier, include or both social, physical, mental, a lot of sexual abuse, and yes, they are influenced by. Um, they also differ or are influenced by one's social demographic characteristics, if you will, or status. So, in other words, there are, to the extent that other structural factors affect um, your setting, it will also affect the type of violence and the magnitude. And what do I mean here? For instance, you are likely in our setting, if you're a girl child, to the extent that being female as a social demographic characteristic affects your other social cultural, the aspects of life. You are likely to, for instance, face more discriminatory practices as a girl compared to a boy, which practices eventually might expose you more to violence. So exposure to violence might be more for a girl compared to a boy if being a girl uh, predisposes you to certain, for instance, cultural or labor practices, going to collect domestic water collection, for example, that we normally associate with, sort of during our socialization, that, household chores are, unfortunately, certain household chores will be seen as the, area of for females. So to the extent that we discriminate females, the girl child, that way, then she is more likely to be exposed to violence. I want to point out right away here that there are certain known, you know, um, factors that influence anyone's social dimensions, well-being. So poverty, the way poverty follows our, gender, stratifies us by, gender, our exposure to poverty. You find, for instance, if a home does not have enough income, in a rural setting especially, but even in urban areas, and you are supposed to educate a child, but you know that a girl is going to get married off, you are more likely, as you pointed out, to ask the girl to drop out of school, in which case she'll be more exposed to other forms of violence, including sexual exploitation, early child marriage, and any other in that line. So when you follow that pattern, you will see forms of violence, different forms of violence that you can label, you can identify how they are varying. The exposure to that violence is, or the likelihood to suffer that violence, varies by your education status, your gender, your level of income, and whether you're in a rural or urban area. And sadly, overall, the girl child still suffers more than the boy child in our setting. So the consequences of violence against children we know there is profound health and social consequences. They include increased risk of depression, suicide, conduct disorder, disruptive behaviors, risky sexual behavior. But you will find patterns once you examine who is being exposed to all these consequences, who is suffering these consequences. You will find the poor educational attainment or increased risk of experiencing violence more among certain types of children, be they girls or girls from rural areas or girls of a certain educational level. I don't know if that helps to clarify, but
It does. What I hear you saying is that not only we can sort of say, look, violence needs to be considered in its context, but it's also patterned.
right.
Mm-hmm.
Yes, it
So,
is. Therefore, solutions to child protection, child well-being. We know we need the direct solutions, but cannot be done outside of or absent of improving all the other sectors, sort of to follow a holistic kind of framework. You cannot leave education of the girl child away from, if your goal is to improve or reduce the risk of early child marriage and sexual violence, and you've got to improve household incomes, for example. So broader structural factors, we cannot divorce ourselves from advocating for betterment in those structures.
one of the most provocative chapters I found in the volume was the one on the increasing relevance of maternal relatives to the lives and well-being of orphans, even in the context of sort of formal and sort of formally recognized and socially validated patriarchal relations, right?
Yes.
That
Yes.
children, even though children formally belong to their father's clans, their maternal grandparents are becoming essential to their well-being in ways that I think the chapter really raises the question about, like, well, what is ultimately going to be the impact on these more formal structures of kinship of these sort of increasingly informal but practically speaking deeply relevant and necessary forms of relation between children and their maternal kin. What do you see being the where is kind of the point of advocacy in that?
Yes, thank you very much. That is a very interesting um, chapter, because again, it is one of those chapters where if you evidence that if you were to discuss with potential I don't know, policymakers or even back with the community, you might get very interesting pushback. Because imagine if I went to the community where to call a meeting with community members, I would probably have more men sitting around, and then I'm going to tell them that it's about time we start uh, advocating for the rights of women to access certain resources, including culturally controlled resources,
Mm-hmm.
just because these women have now taken on more of the practical, the actual upbringing of this formerly vulnerable child. So you have a vulnerable child, such as orphans,
Mm-hmm.
or children of parents who are separated, whichever it is. And the first person designated to look after these children is the maternal grandparents, grandmothers. So, unfortunately, in this setting, you need resources. You need land. You need access to money to go for healthcare and other issues in child protection. Unfortunately, the way resources are distributed culturally, there's a lot of, it ends up being discriminatory. Not so many women have access to very important resources such as land or income generating activities. That is left for the men. That is in the realm of men. And at the same time, identity, your identity as a child growing up is defined through your paternal, lineage. And I think this keeps on reinforcing that discrimination, clearly. I mean, if you only think in terms of, you take the clan of your father, so you are entitled, inheritance, access to land. You're entitled through your lineage, your clan, access to critical resources. Now, if you are an orphan, you almost certainly lose access to this land. There are high chances because as an orphan, if your father's clanmates, siblings or whatever come and take over that land, you may not have access to them because your care, including physically going away and living with your other maternal relatives, may limit your access to these resources. And we begin to see children, especially those who are orphaned, but even those of living in separated families, and therefore going away to live with, not with the new family where the man maybe is having a new family, but with the maternal grandparents, losing out, beginning to be exposed to multiple layers of vulnerability. So it is a very, again, it is one of those sites of inquiry, if you will, that are very complex to deal with, but we need to face it. We need to know that one approach to improve the chances of such a child, where the system, whether informally or you might even say formally, allows for the parent, the maternal grandparents to take care of this vulnerable child, they are being shifted to deprived settings in comparison to where maybe they may have got better help. So yes, we need a lot of work to try and build this point in ways that don't get pushed back so much, because sometimes we are seen as people trying to impose different views on cultures, on cultural practices, so it can be a very difficult issue to articulate. Yes, I'll stop there.
Thank you for that answer, David.
Thank you.
Kathy or Amir, did you want to? I was going to open things up to questions.
Yes, this is a fascinating conversation. Let's bring more people into it.
let me just end my part of the interview by thanking David and also extending my condolences to the family of Angela, the 12-year-old girl that David mentioned at the beginning, to whom he's dedicating this interview, who passed away from malaria.
Yeah, thank you.
So yeah, thanks both. And for anyone that has questions, they can just feel free to unmute themselves and just ask the questions. Or alternatively, if you're unable to do so, you can also ask questions via the chat box. And so you should have seen the chat box pop up just now, and you can feel free to type your questions. And Amira and I will field those questions.
Perhaps I will begin then. David, you mentioned the category of psychological abuse, and I'm very curious as to how that's differentiated from other forms of abuse and what particular patterns you found regarding that.
Yes, thank you. So what patterns of psychological abuse and how is it differentiated? Or what
Yeah,
we
how does it relate to other forms of abuse, and what is the line between psychological abuse and sexual abuse or child labor?
Yes, thank you. From the evidence and how it was gathered, one, it was not identified being separate from, but rather in addition to or together with other forms of abuse. So in the chapters that mentioned psychological abuse, they would have studied physical abuse in school and then asked about reporting or measured certain attributes using, I'm trying to remember which scales they reported using, but they associated among those who were reporting some of the forms of abuse to having experienced some mental or some disorders of conduct, which were then related to psychological abuse, either by parents, mostly people in care, parents or staff, if they were school staff, if they were in school settings. The other big area is where psychological abuse was reported to be happening a lot is among peers, peer-to-peer abuse among children, among street children, but also in schools. And so I guess it's something to do with, almost bullying, if you will. But what I can say is that these forms of abuse were not standalone. So you have people who, for instance, report experiencing certain psychological effects of either being like if they do not undergo certain cultural practices, be fear of being, like during being shamed for not having gone through those rites of passage. You'll know here what I'm getting at is, for instance, the female genital mutilation. Some children will report the fear of how they may not be good for marriage, being reinforced by a parent, for example. You are letting them down by refusing, or you can't imagine refusing female genital mutilation, going through it just because you would be letting down not being good enough for marriage, and the child is going through these thoughts all the time. Does that help? I don't know.
Very much so. Thank you.
Welcome.
Hi, this is Jill. Can you hear me?
Yes.
Hi. So I wanted to thank all of you for a really interesting conversation, and to Amir and Kathy for organizing this conversation. So I think a lot of important issues came up, and I look forward to maybe more discussion on our listserv or elsewhere. So thanks very much.
Thank you very much for your compliments.
And let me add my thanks as well.
This conversation's touched on so many different aspects of working in Uganda on this specific topic, and on so many aspects touching the well-being of children. So I've enjoyed it very much. Thank you both.
Thank you.
And thank you. It's been a pleasure.
Yeah, thanks all for attending, and a recording of this event will be uploaded on our Vimeo channel, and will also be circulated on the listserv and on the website. So for those who don't know, our Vimeo website is vimeo.com/psychenv. So this video should be up sometime later this week. Thanks so much.